All right, so I want to say thank you to Kelvin, who's kindly agreed to do an online recorded session looking at some elements of the subjective assessment. What we're taking the scenario whereby Kelvin has been referred for physiotherapy on the back of him wanting to improve his walking. So I'm going to go through some of the key elements of the subjective assessment, and obviously we're going to be able to record Kelvin's responses. So thank you, Kelvin. So good to meet you. All right, Kelvin, so can you just tell me a little bit about what happens, in other words, what happened in relation to your stroke and when that was?
Okay, it was about 2015, 5:30. Just previous to that, mind you, I was in the gym. I was healthy. I felt healthy. Okay, so I probably was slightly stressed out in any case. And 2 days prior to that, mind you, I was doing aerobatics in a small biplane, mind you. I was pushing higher Gs than I normally do because I was a guy who was an instructor, and I was pushing plus 5.5 Gs and minus 2.5 Gs. So much more stress on the body than normally I've been used to. But anyway, 2 days later, I was struggling to put a rear wheel back on the motorcycle, which was a lot of straining to do, mind you. And I had a half hour to go before meeting up with a friend for a drink, and I went for a cycle ride, which I normally do quite regularly. And when I cycle, I don't cycle gently. I tend to cycle quite hard. After about 5 minutes of cycle ride, I started feeling this weird sort of sensation like water on the brain, started dripping down on my brain side. Then start losing sensation down my left-hand side. Carry on cycling for a minute or two and hoping things would improve, mind you, but gradually things got worse and worse. And eventually I'd go onto a hard shot, onto a curb, onto a green area, and I fell off the bike, hit my shoulder on a signpost, and got myself up okay, but this arm was completely dead. At first I thought, I broke it, something a bit weird. Then I just collapsed on my left-hand side and realised this is serious. This is a lot. I realised then there was a stroke because while I was straddling on the floor, I got my phone out and tried to talk, and then, of course, my left-hand side of my face dropped completely, mind you. And I spoke to a friend I was meeting up with, mind you. He could barely understand what I was saying, mind you. So I might be resorted to do texting soon.
So you realised, Kelvin, you realised that you'd had a stroke?
Oh yes, very early on. All the symptoms there, mind you. When I just clapped straight away, mind you, I thought, this is it. I was like, I've had it. You know. I mean, just before, I mean, during that time, there's a lot of adverts on TV about stroke in the way, mind you. So the
so you'd seen the adverts and you recognised the same was happening to you.
Very much so, yeah, things. And so you hope things will improve, mind you. Okay, so I was there for about 20 minutes. I said, somebody stop. I said, did you need a hand? I said, yeah, I will do. Need a hand. And they got a paramedic. And I wish now I went to Cambridge now, because I thought it was a clot. I went to the nearest base with Lister, because my wife works there, and so it should be easy to see me, mind you. And it turned out to be a bleed in the end. And basically, they can't do much with a bleed. There's only a couple of hospitals in the country which will go in and take the blood out that area, mind you. It's used more dangerous, mind you. So all they can do is monitor you, and that's it.
Okay. So you had your scan at the hospital there, and that's where they diagnosed that your stroke was due to a bleed.
That's right. Yeah.
Can you remember? This might be me digging a bit. Can you remember what area of the brain, which artery you had?
The artery was, but it was based in near, not very far from the centre brain.
So I think from memory, Kelvin, I think it was the middle cerebral artery.
Yeah, basically it's intracerebral hemorrhage is what they call it. It's termed as basically. So, and they say that's most common to people who had hypertension. But they gave me blood pressure tests every 2 hours, so I never got a night's sleep at all. In any case, every 2 hours I was woken up basically to.
So very briefly then, following, so you were in hospital, you had that diagnosis of a hemorrhagic type stroke. And how long were you in hospital for?
2 months, mainly because they could not get a rehab place. The best place they were trying to get into was in Welling, which is I put the name of it now, mind you, was one of the best rehab places at all, mind you. But because I lived in Bedfordshire, and I even got the MP involved because I'm the iPad and I was literally MP, and basically came down to location. Unless you're in Hertfordshire, you don't go to this place. If you're in Bedfordshire, tough place, guys. And the only rehab place in Bedfordshire was a place near Bedfordshire Hospital, which is made for geriatric patients. There's no physio there, only about 2 or 3 times a week. So they thought, to get me fit enough, those days, about 25 minutes a day to hospital, mind you, till I felt I was fit enough to go home. I could have gone home a lot earlier, guys.
Keep close to the mic,
Oh yeah,
Kelvin. I
yeah,
feel I'm
yeah.
losing your voice a bit.
Okay, yeah. I
Okay,
could have
so
gone home.
2 months. That's okay. So 2 months in total.
Yeah,
In hospital, having rehab and that, and then back home.
that's right. Yeah. Then what I did then was I got myself a mobility scooter, and then went back to gym, and then started working at the gym. I could have done that a month earlier, to be honest. Actually, in the case, if I'd known they wasted so much time hoping to get me to a rehab place, I should have discharged myself and gone to the gym and did a lot more, to be honest. In the case. And
it's
then,
so easy with hindsight, isn't
oh, very
it?
much so. Yeah,
Yes,
exactly.
yes.
And so I think a month was wasted, at least, anyway. The other thing is then that I did have home help, home physio, and to be honest, actually, that was basically just read off a sheet to the basic exercises, which this book will all give for geriatrics, to be honest, in case. And considering I was fit and healthy beforehand, I was at the gym every day and cycling regularly, mind you, I felt it wasn't really challenging enough. And after a few months, they discharged me because I was doing too much, because I was going to the gym every time. So
okay.
Yeah.
Thank you for that. So I'm gonna, and then I just want to ask you a little bit about sort of your what we call past medical history. So have you had any major illnesses or injuries or any surgery in the past?
No, the only thing I was suffering from, which might relate to this, remind you, was I had high cholesterol, but I was on statins, but I did stop taking those for a while.
You were on statins, you say?
Yeah, statins, because I started controlling my diet, basically, anyway, more in the case. And because I was also deemed as pre-diabetic, I also controlled my diet a lot more. So I was actually 9.5 stone, just under 10 stone when I had the stroke. So I was very slim and lean in any case, and drove myself hard in the gym. So in theory, I was doing all the right things, mind you, but in the case, yeah.
Yes. Okay. And so no major illnesses or injuries in the past?
No, not at all. Really, no, that's the thing. So nothing that related, mind you. So the other thing was the pre-diabetic based thing.
Yeah, sure. Okay. And then just briefly about your drug history. Are you on any medication at the moment?
None at all, actually. I mean, they were threatening to put me under metformin for my diabetes.
Metformin.
Metformin, in the case, yeah. Because my sugar was still not that bad, but still on the high side. Even though I'm trying to keep my diet careful. Diet. The only thing I'm taking is chromium preclates, I think. It's basically it's reduced to and also cinnamon supplements, just supposed to reduce sugar levels, basically.
Okay. So all around controlling your blood glucose levels.
Yeah, very much so. Yeah. I used to
and no other medications.
No, that's all. No, that's all. Yeah.
Okay. And then just as I know, you have had Botox in the past.
Oh yes, that was interesting. The first time I had Botox was at Lister Hospital, and the way they inject Botox is ideally use what's called a Clevis machine, which is basically a machine that's a device the size of a mobile phone with a needle, and they turn the probe. And so basically, they put the needle into your arm, and they look for the clicking noise of the overactive muscle group, and then once they got it, they inject it, and that's it. They've got the right area. Now, the first time I had this, mind you, it was basically done by a consultant in Lister Hospital who just guessed it. He just rubbed your arm and guessed it, and for a whole year, it was totally ineffective. No effect whatsoever. Until I went to a physio place in Southend. The guy recommended a chap in St Thomas Hospital, and he used a correct machine, and within a few days, I noticed a difference. My fingers became straight. Mind you.
So it was effective. So once you'd had the injection in the right muscle that was showing spasticity, then you had the relief from spasticity, and you found that it actually allowed you to passively open out your hand.
And because of that, I was able to get a glove on. Much easier. I was able to buy the Savo glove to do more exercises. And so it obviously worked very well, mind you. And I even did these 3-week upper limb therapy course in UCL. And again, had it not been for the Botox, I wouldn't have used the glove and done some exercises, mind you. But
that's interesting. We might come back and discuss the upper limb therapy program at another time, because that's something that we will be introducing to the students. That's lovely. Thank you for that on the drug history. Now we're going to move on to what we call sort of social history. So I think what's important here is to try and sort of get a feel as to the impact that having a stroke has had on your lifestyle. It's sort of thinking a little bit about what you're able to do now, but perhaps do it in a different way. So possibly if we think about, if we start with, are you working?
I was working up to last year, and then the companies, like all IT companies, are going through a tough time at the moment, and they had massive redundancies. So this time, actually, I was getting a voluntary redundancy package, and I was working from home remotely, mind you, because the company was actually moving to try and work doing code upgrades and support from home, basically. So and that was about as idea suited, because I had all the PC stuff behind me, mind you, in the case, and
Yes.
stuff behind me. So I was
So
actually
had you been, was it the same job that you did before you
same
had your
job.
stroke?
And be honest, a lot of people were trying to get all the engineers. The only thing I didn't do was in standby, which I couldn't do actually. But I was still working on field work, but I had to have someone with me, mind you, in the case. And that was frustrating, because you're trying to do things quickly. And there was one situation in London where, in the city, where there's things working to and go, mind you. And due to my disability, you had to put a card in the security lock to open the door. I couldn't do it quickly and lock myself out twice. And I was going all the way downstairs to security, get a lock, mind you. And that's where that's when you realise this disability can be really frustrating sometimes, anyway.
Yes, yeah.
And so, and also you had the stress, and you're thinking, I could have another stroke here, I look too careful. So when the redundancy offer came up, I took it, because we were going to plan to move to Cornwall, mind you, which will be in a few weeks' time. Okay, so yeah.
Lovely. Okay.
So, yeah.
Okay, that's great. And then just a little bit of a feel of how you spend your leisure time. With, I know you've sort of referred to a few things that you do now. So
okay,
what do you like to do in your spare time, and how perhaps is that different now?
Okay, well, pre-COVID, straight up in mind, obviously, I was telling the things I carried on doing after stroke was go to the gym regularly to keep myself fit and work on the work bits that didn't work properly. And I was a keen private pilot, I was a sales of the aircraft, but I found that I could go to gliding, and the gliding I could actually do because the arm was strong enough to pull the air brake in. I actually could glide without any assistance from the instructor at all. But I couldn't go solo because of the health and safety risks, because I couldn't get this arm down quick enough to release air brakes or in an emergency situation. So I always had to have a safety fight. But with COVID now, mind you, all those clubs have been closed now, mind you. Okay, so
sure.
And so now, and also gym's closed, and now I use equipment in my garage to keep myself fit. And also, I'm now, as I was interested before, into 3D printing and CAD software, mind you, and try and get into some Python coding as well. So, and also taking another hobby, astronomy as well, mind you. So,
sorry, say that last bit again.
Astronomy. I bought a telescope 1 week before I had a stroke, and also a tracking one. And when I had a stroke, it just got left aside and never got a chance to use it. Now we're going to an area where there's hopefully less light pollution in Cornwall. And there's software available now which can really improve images on what you take photographs, mind you. It also
very interesting.
So there's always, I mean, with YouTube, there's no excuse. There's always things to learn. There's always there, mind you. Yeah. So yeah.
And just to clarify, so in terms of what we call all your activities of daily living, in terms of getting up, dressing, washing, moving around, you're completely independent with all of those.
Well, the wife helps. Yeah, I mean, when she's been on holiday for 2 weeks, for example, in the case, and I've been left.
Sorry, say that again, just a bit slower, Kelvin.
She's been on holiday for 2 weeks or more, in the case, and before the COVID, obviously, in the case, and it's just me and the cats, basically, so that's fine, in the case, and so I can cope, I can live perfectly okay, drive okay with adaptation of the car. So effectively, I'm independent, really, in the case, The only frustration is, as I find out, mind you, when moving, is lifting things and trying to do things one arm is very difficult, mind you. Because things I could have done without getting a tradesman in, I'm gonna have to get a tradesman in, for example, replacing a tap, for example. In the case, that's frustrating. Jobs I can normally do myself, normally I can't do easily. Things, and so that's why I get a PIP for. That's why I get the personal independence payment for, to help pay for those things anyway, because I can't do them. So and
then just a little bit about just sort of focusing a little bit now on your walking. So obviously you walk independently. Can you just tell me in a little bit more detail which aspects of walking you find most challenging?
Yes, it's hyperextension on my knee. A few months ago, I went to Cambridge to have some injections. They were going to try phenol on my knee. They tried, first of all, an anaesthetic on the to stop the ankle pushing down all the time, which puts my leg into hypertension all the time. And when I had the anaesthetic for it only lasted for a few hours, but I noticed by going up five flights of steps, it was much easier because I wasn't fighting the spasticity. I didn't need so much. So I tried the injection of phenol, which surprised me because phenol normally is a quick reacting. You get some bit of pain first, and that's it. But I had no pain and then no reaction whatsoever, mind you. They put Botox me on, but by this time the Botox now become totally ineffective now because I've become resistant to Botox, so that didn't work either. So,
so having had some phenol injections, it's actually decreased your spasticity in your calf muscles, which has made it a bit easier for you to get up and down stairs and things like that.
It should have done what the anaesthetic did, but when you put the phenol in, it made no effect whatsoever.
So the anaesthetic was successful, but the phenol wasn't.
Yeah, which makes me wonder: did he put the phenol in the right place, or was he using phenol in the first place? Because the trouble is, with phenol, it's supposed to react very quickly. You're supposed to get minor pain because it basically burns the nerves.
Sure.
And I got.
So do you feel that it is very much that spasticity of which is causing you point your toes, you can't get your heel down? That's the big issue that you're finding is limiting your ability to perhaps be able to walk quickly or move around quickly.
That's exactly, and that's it. So what things does help if I'm not wearing shoes or a limb is after AFO is that thing.
That's the ankle foot orthosis, the AFO.
Yeah, so it goes on your back in your knee, and then it just helps bring up that foot, so I can walk around. Not easy, but much easier than I would do without having this on, basically. I mean, it's
and that's your electrical stimulator there.
Yeah, £2,000, unfortunately. Is it worth it? I'm not so sure, to be honest, in any case. But it means that if I went for a swimming pool, we were on a holiday one time, where you've got barefooted, you can wear this, not having to wear an AFO, basically, so it's quite handy. Just can't swim with it.
Yes, no, that's right. Doesn't like the water, those devices.
Yeah.
All right, that's great. Is there anything else that you'd like to add? Anything else that you think perhaps is important in relation to your history, your journey? I think you'd like to share.
I think the trouble is, I mean, some people just. I've been to some stroke groups before, mind you, and some people, and to be honest, are in better condition than I am, basically, because they've got their limbs, but they feel depressed, for example, in any case, depression and those sorts of things, in any case. And I think it's down to the person I like being inventive, so if I've got a problem, I'll try and invent a way around this or make some tool to get around it, mind you. So as I'm into modelling, register modelling, boat modelling, yes, I've done things. It's still frustrating, mind you, but I try and find, if I can't do it on one hand, I try and find a way around it, mind you, in any case. So, so you've got to be a person to be, if you're inventive, I think you can cope more. If you're going to sit in front of TV, like I've heard some people do, mind you, then you're not going to get better, you're not going to improve.
Yeah. And so you're very sort of in tune with identifying what the problems are and trying to work out a solution to get around them.
I might get angry. At the time I get really frustrated and angry, mind in the case, mind you. Then the more you get stressed up, the more spasticity your arm goes in, more it gets worse. So you've got to try and reduce your stress levels more as well. And driving's okay, mind you. Okay, so I can drive with the spinner and the automatic controls, mind you, without too much trouble. And I can use
the driving. Did you say, Kelvin?
Driving, yeah. So I can hold on to steering wheel a bit. Okay, so and
so you've got some adaptations in your car to allow you to drive using the one hand.
Yeah, they use the adaptations, which basically is that you've got a remote control device which controls the indicators and lights. So and the spinner, so you control everything with one hand, basically. Anyway. I mean, to be honest, I can hold on to steering wheel, okay, and I can do minor contraction steering wheel, but I just can't get my arm to steering wheel quick enough to use it. I've got to place it there. And things like that.
That's useful. Yeah, that's very useful to know about the adaptations and that you can still drive, but your car's modified to allow.
I mean, again, you can't just go up and do it yourself. You've got to be tested by HAD in Reading, for example, and they assess you for driving those guys. And they recommend the various aids. I mean, I've got away with my previous car was a Smart Roadster Coupe, a sports car. Not the best car.
Oh, very nice.
Not the best car, but because I wanted because I lost my motorcycles, which I was a keen motorcyclist, I thought I might have a sports car. In the case, mind you, not the easy car to get into when you've got a dodgy leg and a bad tire.
I think on that note, we're going to end there with the thought of you in your sports car. All right. Thank you very much for that, Kelvin, and I'm sure that's going to give the students a really nice sort of insight into your elements of your journey so far. All right, thank you.
No problem. Thank you. No problem. Thank you.